my name is Mangesh Ridya. I'm from Pune, India. I have just recently graduated from my medical school. I am planning to pursue residency in the United States.
And how did it feel to present in front of an audience this size? I think this conference has more than 20,000 people participating, and I know you had a lot of people at your presentation. How did it feel?
Honestly, it's a surreal experience. The magnitude of your presentation, the impact of your presentation increases many folds when you present at such a big platform. The people you connect with, the people you meet, the things you learn is really magnificent. So I should thank the Meta-Analysis Academy, and I should thank you personally, Dr. Cardoso. You were the person because of which I am standing here. I am getting this chance to, show my work to the world. So I should thank you and Meta-Analysis Academy for this wonderful, great opportunity.
My name is Suman Pical. I'm a first-year extracorporeal medicine resident from Costa Rica, and I'm really happy to be here and couldn't be more grateful. I learned how to do meta-analysis in the Meta-Analysis Academy. It was really fast. In less than 3 months, we ended up doing my first one in the mentorship program with Rafael in 3 weeks, and it has literally changed my life. I'm so excited for what's coming, for all the people that I've met and all the mentors that I've known.
Hello everyone, my name is Amanda. I'm one of the directors of Meta-Analysis Academy, and I'm here at ENDO 2024, one of the largest endocrinology conferences in the world. I'm here with Tamara, who's an endocrinology resident in Brazil, and she brought 3 projects to present in this conference. Tamara, how has the experience been so far?
It's definitely been a big experience in my life because it's my first international conference in endocrinology as opposed to presenting. I am already planning the next year and the next conference. I'm truly glad to be here. So I definitely would say that Meta-Analysis Academy has taken my career to another level that I could never imagine.
Hi, my name is Aline. I'm originally from Brazil. I am of an upcoming PGY1 in the University of Central Florida in Orlando, and this is the meta-analysis that my group and I did.
So guys, my name is Marcelo Braga. I'm a third-year medical school in the Federal University of Rio de Janeiro, back there in Brazil. And I'm here in American Heart Association presenting my posters. We'll have 3 posters here, 2 today, 1 tomorrow, and an oral presentation in 10 minutes.
I'm Esther. I am a PGY2 of internal medicine in Chicago.
Well, I learned with Dr. Randerson Boris with the Meta-Analysis Academy. Before this, I didn't know how to do meta-analysis, and I learned from scratch during residency.
Wow, so during residency, I mean, working 1,000,000 hours a week, I'm sure. You're able to bring how many posters here, or how many presentations do you have at American Heart Association?
We have 3, 1 as a first author and 2 as a co-author.
How was it possible that still in medical school, you did this?
I think the method that Henderson teaches us is really life-changing, actually. He teaches you to perform high-impact research in a fast manner, which is awesome because as health professionals and medical students, we don't have a lot of time.
Hi everybody, here is Maisa, and we are at the ASCO 2024. How are you feeling, Jonathan?
I'm feeling awesome. It's an amazing opportunity here.
Is it your first ASCO?
Yeah, it is. Actually, it's the first congress of my life.
Your first international conference, right?
Right, my first one.
Yeah, no, that's amazing. Congrats for your poster.
Hi guys, I'm Thais. I am a neonatologist and I'm here in Toronto, Canada for the PES meeting 2024. Yesterday, me and my team presented an abstract about the management of patent ductus arteriosus, and today we have an abstract about the surfactant with or without budesonide, and another one about low dose of prostatin. Thank you.
One final word of advice for people who may be listening from India, Pakistan, Europe, Asia, South America, and they want to do research, maybe to go to the United States for residency as well.
Everyone know how research is important for residency application, and I know how everyone want papers behind their name. This is the thing that gave me almost 10 abstracts in 6 months, and full papers are on the way for submission. So you know the importance and you know what to do. Just join the course and you will see the results for yourself.
Hello everyone, hello, welcome to day 2 of the publication roadmap. I'm excited to share today with you a lot about the next steps after you develop your own research ideas. How's everyone doing? Say hello in the chat. Remember to invite your friends to join and watch the publication roadmap with you. We're going to discuss the exercise today. We're going to go over the next steps after you do your own, you develop your own ideas. Everyone doing good? All right, glad to see everyone here. Okay, guys, so we have a lot to discuss today. We're going to jump right into it. This is day 2 of the publication roadmap. Don't forget to share the video with your friends. Copy that share button, get the link, click the share button, get the link, and send to your friends, okay? I would be very grateful for that. So let's go ahead, guys, and kick off our day 2. Let me know also what you guys thought of yesterday. Did you guys like the exercise? What are you thinking in terms of your research ideas? I bet you know there's a million things going through your minds right now after day one of the publication roadmap. But let's get on with the program because we have a lot to discuss here today, folks. Okay, so today is about breaking barriers, okay? Yesterday we talked about all these difficulties that you guys face in doing research wherever you are in the world, okay? Whether you're in India, Colombia, Europe, wherever you are, these barriers, they tend to be very similar for many people. So lack of time, lack of research skills, lack of research funding, lack of a good group, a network of collaborators, lack of mentors, lack of support from your institutions, and lack of knowledge in statistics. That's a big barrier to a lot of people. So what we're going to do today is we're going to break these barriers. We're going to go step by step on how you guys can overcome these issues and achieve really fantastic results. Okay, so today is about helping you to learn what goes beyond the idea. Yesterday we talked about developing 5 methods to develop impactful research ideas with autonomy. Now I want to highlight that word impact. What I teach you guys here in the publication roadmap and in the meta-analysis academy is for you guys to publish relevant papers like this one. This one is from Helen, a third-year medical student. She published on the use of antibacterial envelopes for neurosurgery, for a specific type of neurosurgery. And look where she published it. This is one of the highest ranking journals in the world in neurosurgery. And Helen, who's a third-year medical student, published there. So this is the goal, not only that you learn the skills to publish, but that you actually publish really, really well. Okay? So what are the 5 methods that we learned yesterday? The bedside, recent publications, hot topics, conferences, and guidelines. I want to remind everyone that a really powerful method that you can apply right away, in fact, you probably did already if you did the exercise, a really powerful method is the newsletter. The newsletter is a way for you to get updates on the controversies in your area of interest. Remember, when we're looking for ideas, we're essentially looking for controversial topics in the areas of our interest. So the newsletter is a great way of doing that. And I want to emphasize to you guys that these methods, they work regardless of your background and training. So João Victor, for example, he's a pre-medical student in Tampa, Florida, in the United States. He's not even in medical school yet. He is a pre-med student, and he published a strong paper here in the Journal of Thrombosis and Thrombolysis. Again, this is someone who doesn't have clinical experience, who is not yet in the hospital, who is not even yet in medical school, and he published this paper as first author. So don't be discouraged if you're earlier on in your career, but also if you're more advanced. Like Matteo is one of our students. He's from Italy, and he is an otorhinolaryngology resident, an ENT resident. And he published as first author on robotic surgery versus conventional surgery for submandibular stones. So it doesn't matter if you're a pre-med student, a first, second, third, fourth year, or if you're a resident, or even if you're a senior doctor like Bernardo, who is a surgeon, a colorectal surgeon. Okay, these are all students of the Meta-Analysis Academy who learned the same methods that I just taught you guys for developing ideas. So never look at this and say, oh, I can't do it because I'm too junior. No, this works for everyone regardless of your background of training, okay? So let's go over the exercise to show you how straightforward it is to develop these ideas. Let me know as I pull up the exercise. You guys let me know in the chat if you did the exercise, okay? Yes? You guys did the exercise? Let me know in the chat while I pull it up. Just a second. We're going to go over this exercise together now, okay? Just 1 second here. All right, team. So let's actually do this. So this is the exercise. Okay. It was available in the transmission page. I suppose everyone did it already. Let me just fix this. There we go. Okay. So in the exercise, the first method is for you guys to look at recent publications. Okay. So I asked you guys to find the best journals in your area and then to subscribe to 3, 4, or 5 of those newsletters. Okay. Let me know in the chat what is your area of interest, whether it's pediatrics, psychiatry, nephrology. Let me know your area of interest and which journals you picked to subscribe to. I'm going to show you some examples here, and I picked some really popular areas that are not cardiology because I'm a cardiologist, and then you guys would think it only works for cardiology. So I picked oncology, neurology, and surgery to do the exercise here. Okay. All right, you guys put some great ones there in the chat. So I'm going to do it for neurology, oncology, and surgery. Okay, but obviously this works for every single area. I'm just using these as an example. So the first one is for you guys to subscribe to journals. So if you like oncology, for example, I'm going to show you guys right there. JAMA Oncology is a great journal. Lancet Oncology is another great journal. The European Society of Medical Oncology has a journal called Annals of Oncology. And then you could also go to the Journal of Hematology and Oncology. Those are some examples. And I'm not an oncologist, and I found this out. How did I find this out? Do you guys remember? It's easy. You just go to ChatGPT. Go to ChatGPT and ask, what are the most influential or what are the highest ranking journals in my area of interest, whatever your area of interest may be. Okay, so I'm going to actually do that. What are the highest ranking medical journals in, let's pick a field, let's pick neurology. Okay, so you can do this and ChatGPT will give you those answers. Okay, so this is a great way. Look at that. The Lancet Neurology, Nature Reviews Neurology, Brain, Annals of Neurology, and Neurology. So those are great journals for you then to come and subscribe to their newsletters. Okay, what about in surgery? Well, in surgery, you could do JAMA Surgery, all right, Annals of Surgery, Journal of the American College of Surgeons, that's another good one, British Journal of Surgery. So those are all great journals in the surgical field. And it's very easy to find out what these journals are by doing this. Next, you have to go and actually sign up to their newsletters. For example, JAMA Oncology. If you like oncology, all you have to do is put your name, your email address right here. Okay, just put your name and your email address. And this will give you weekly reminders of what's new and hot topics and controversial debates in the area of oncology. So that's just one example of a journal you could subscribe to in oncology. Here's one that you could subscribe to in surgery, Journal of the American College of Surgeons. It's a fantastic journal in surgery. All you have to do is click here, get new issue alerts, and you would be reminded of the hot topics in surgery. Here's one that you could do in neurology, the Green Journal. Okay, it's called the Green Journal, Neurology. Okay, you could come here, all right? You could just come here and sign up for alerts. Just sign up for alerts, okay? All right, so these are ways that you can get informed of everything that's being published in your area in that journal. And you could do this for multiple journals. And then when you get that, every week you look at their title and you look at their abstracts. Look at their title and abstracts. And if you do this frequently, regularly, you will come across great research ideas. All right? Sounds good? All right, so next, let's go on to the other part of the exercise, which is to pick at least one idea based on recent publications from these journals. So if you guys go to like neurology or any of these journals, you can see the latest articles, the recent publications. You can even click here and expand it and go to all articles. If you do that, you will come across some potential ideas for research by just looking, reviewing their recent publications. That's what we do when we sign up for a newsletter. And I picked some examples here to show you guys. Look at this one here. This one is for those interested in oncology. This one is about this specific drug combination in patients with metastatic prostate cancer. This is a potential idea for a meta-analysis. Will it work? Well, that's a future step. You have to start with an idea, then you're going to test the viability of that project. We're going to discuss that later today. But first, you have to start with an idea, and this is a potential idea. It's the Lancet Oncology. It's a recent publication from July, as you can see. Let's do one in surgery. Look, what a fantastic idea in surgery just came out about abdominal drain after left pancreatectomy. Now, I have no interest in this. I'm a cardiologist, but you guys may be interested in this, right? You guys may be interested if you like surgery. Look, there's 246 patients, and these patients were randomized to having left pancreatectomy with versus without abdominal drainage. So it's quite simple. It's a great study. It's a great idea. Patients have a left pancreatectomy. Should we leave them with a drainage or not? This is a great idea to work. All right. So this is, how did I find it? Very easy. Just go to Annals of Surgery and look at recent publications. Let's finalize this section with one in neurology. Look, focal hypoperfusion on MRI and the risk of subsequent cerebrovascular events in patients with a TIA. There's an idea. There's controversy around these topics. How do I know, guys? Because it's being published in a really high-ranking journal. It wouldn't be published in neurology. It wouldn't be published in the Annals of Surgery. It wouldn't be published in the Lancet Oncology if there wasn't controversy around it. So the controversy feeds into the idea, the value of the idea. And you can take advantage of that and potentially do a meta-analysis on that topic. Okay? Is this clear to everyone? Everyone with me? You guys good? Can I move on? Let me know in the chat. Remember, this works for cardiology, this works for cardiac surgery, this works for neurosurgery, this works for whatever it may be. All right, I'm only doing it with oncology, neurology, and surgery because those are very popular areas, and because I didn't want to do it with cardiology, because then you guys would say, oh, it's just because he's a cardiologist. That's easy because it's cardiology. And let me tell you something. These examples that I'm showing you, I did them myself. Okay? I'm not a surgeon. I just followed the same technique. And I went looking for ideas, even though I'm not an oncologist. I'm not a surgeon. All right, next we have to find out podcasts. Is that right? Next, we're going to find podcasts in the area of interest. So let me know in the chat what's your area of interest and what's one podcast you would recommend in your area of interest. I'm going to show you here one for oncology. All right, look at this one, guys. American Society of Clinical Oncology. Okay, they have a podcast called JCO Podcast right here. JCO, Journal of Clinical Oncology Podcast. All right, so you can listen to this, stay updated, and find out new ideas, hot topics in your areas of interest. This is a cool one, The House of Surgery. That's a cool name for a podcast. The House of Surgery. Any surgeons in the house? Any surgeons in the audience? So people are recommending some great ones in the chat. Okay, Behind the Knife. That's another cool name. I guess the surgeons are really creative in their names of their podcasts. Behind the Knife. That's a cool one. All right, this one is The House of Surgery. Look, let me show you something. Look at episode 59. Look at episode 59. What did they discuss in episode 59? They discussed the highlights of the annual trauma meeting. Annual trauma meeting. Let me ask you this question. In the annual trauma meeting, do you think they discussed controversies in the management of trauma? Do you think they talked about hot topics, that they talked about debates in the field of trauma? Of course they did. Of course they did. So if you listen to a podcast that summarizes the annual trauma meeting, what that means is that you're going to learn about trauma management, you're going to learn about it, and you're going to get insights on controversies in that field. Same thing here. Look, takeaways from the ATLS Global Symposium. So if you listen to these episodes, you get fed hot topics. You get fed controversies. You get fed research ideas. Okay? That's how this works. Here's one in neurology, the Neurology Podcast. Okay? That's a simple name, Neurology Podcast. All right? Very intuitive. Okay? So there's another example. All right. Let's wrap this up with some social media accounts that you guys may follow. Look at this one, European Society of Medical Oncology on Twitter. Okay, American College of Surgeons on Twitter. All right, Neurology Journal on Twitter. Follow these accounts. Okay, this will help you. This will give you insights on good research ideas. Okay, so I have one final part of the exercise, right? Which is the final part, which is to go to up to date, if I'm not mistaken. So up to date. What types of ideas did you guys get from up to date? So let me know in the chat, okay? Let me know what research ideas you guys got from up to date. I'm going to show you some that I got here. Give me 1 second. I just need to fix my screen share. Okay, so these are some ideas that I want to share with you that I got from reviewing up to date in these areas of interest. Let's take a look. Look. So, in breast cancer, all right, this is in the up to date hot topics section. Okay, so in breast cancer, there's a section there saying about the use of inavolisib, palbociclib, and fulvestrant in PICA-mutated advanced breast cancer. So the simple question might be this one, based on this hot topic in up to date. Hey, listen, in patients with PICA-mutated hormone receptor positive HER2 negative breast cancer, does adding these drugs improve overall survival? So, of course, I'm a cardiologist. I have no idea what they're talking about here. I don't know anything about this. And you may not either. You may be a medical student who's interested in oncology. But to learn how to do research with autonomy, without having to depend on your institution, on your professors and all that, you have to start. You have to start. And this is how you start. You pick an idea, you pick a topic, and then you read more and more about that topic. That's essentially what you're going to do. Okay? Look at this one in surgery. In adults undergoing emergency laparotomy, does the use of negative pressure wound therapy reduce the rate of surgical site infection? Where did I get this idea? I got it from Up to Date, from Hot Topics in Up to Date. This is a great resource for you guys to develop new ideas. Yesterday, I showed you that beautiful example of Isabella, who was a medical student and had an idea in breast cancer treatment from this. And she published it in the European Society of Medical Oncology. So it's very, very reproducible. Here's one in neurology. And this is so interesting because this question in particular is a question that I had in the management of one of my patients. So the other day I was in clinic and I was reviewing my Epic inbox. Epic is our electronic medical record. And I got a message from a neurologist. We have a patient in common. And they said, hey, doc, hey, Randerson, this patient that we're taking care of here in neurology clinic, he's your patient. And he has a subdural hematoma. But he takes aspirin for his coronary stents, for his heart disease. All right, what are we going to do about this aspirin? So this was a question I had to deal with clinically. And this is a controversial topic in neurology. So Up to Date says this about the topic. In patients undergoing surgical drainage for chronic subdural hematoma who are taking aspirin, should we continue the aspirin or stop the aspirin? So this is a controversial topic. How did I find out? Just by reading about it. You have to take that initiative. You have to read about it. Okay? All right? So that's the exercise, folks. Let me know what you thought about it. Did you like it? Did you guys enjoy the exercise? Yes? Very controversial. Exactly right. Okay, you guys like that, I suppose, I hope, but that's the process. If you did that exercise yourself, if you went through that exercise, if you didn't yet, make sure to do it. I know we gave a narrow window because we had the time between day 1 and day 2, but if you didn't do the exercise yet, make sure to do it in your field of interest. Make sure to go ahead and do it for like gastroenterology, for example, okay? All right, so very, very good. By the way, guys, this exercise example is the same way that we'll train you in the Meta-Analysis Academy. It's a very hands-on training program. So there's no way to learn how to do this stuff if you don't actually practice it yourself, okay? We're going to keep going with class now that we've done the exercise. Let me go ahead and share the PowerPoint again with you, and we'll keep going. All right, just like yesterday, just to give you guys a heads up, we're going to be here for about an hour and 20 minutes, and you have to focus. You have to have complete and total focus, because what I'm going to teach you is going to be transformative in your career journey. You only take the benefit of this if you really focus, if you really ignore social media for now, if you focus on the class. All right, so let's go ahead, guys, and talk about these barriers. In this class, we're going to systematically break down these barriers to show you how you can overcome all of them, like hundreds and hundreds of our students before. And one of the barriers that always comes up is the lack of institutional support. You guys may be medical students in many different places in the world. Some medical schools may be stronger or weaker in research, but as a general rule, globally, worldwide, people just don't have enough support from their medical schools. You just don't have support from your professors, from your institutions, from your hospitals, from your universities. So we're going to talk about the role of an institution in in helping you in your research when you do meta-analysis in particular. Okay? Remember, we're talking here about meta-analysis, guys. This is a meta-analysis that we're talking about. I think it's clear to everyone that the publication roadmap is the roadmap of doing meta-analysis. Why meta-analysis? Because you can get the data from different studies that are already published in the literature. From New York, from Japan, from Germany, from London, from all over the world. You get that data and you analyze it in aggregate. Let me ask you this. Answer this question. Where do you think that the institutions are necessary for the process? In doing the primary studies or doing the meta-analysis? So you need the institutions, the ethics committee, the patients, the charts, when you're doing those primary studies at the individual institutions. When you're doing a meta-analysis, you don't require institution at all. The studies were already done in all different places in the world. The studies were already done. So you don't depend on your institution in any way. This is one of our students who came to visit me in Boston. He was visiting family. He stopped by the hospital. I said hello. His name is Kangwa Mulenga. Kangwa, he is from Zambia, and he is in Azerbaijan for medical school. So he's all the way in Azerbaijan, and I don't know what it's like in terms of research there, but it doesn't matter where he's from originally. It doesn't matter where his medical school is. None of this is relevant for him doing a meta-analysis in robot-assisted percutaneous coronary intervention. He doesn't need the robots. He doesn't need the patients. He could be in Azerbaijan, or he could be, wherever it is in the world. The institutions, your country, it doesn't matter for you to do a meta-analysis. Okay, so that's done. We don't care at all about institutional support. You don't need the ethics board, you don't need the professors, you don't need the patients, you don't need the charts, you don't need any of that when you do a meta-analysis. So you can scratch that off the list. You can scratch it off as a barrier for you to doing research. Let's talk about lack of mentors. Okay, let's talk about lack of mentors now. This is an important one that we have to destroy. We have to destroy this barrier. But over here, the way we're going to destroy the barriers is not by saying we don't need mentors. That's true for the institutions. For the institutions, we say we don't need them at all. But for mentors, we're going to take a different perspective on it, and I'm going to show you how right now. So, how do we get around the problem of not having good research mentors? Here's how you do it. When we talk about research mentors, essentially we're talking about networking. It's about meeting people that you can contribute with, that will contribute with you. And here specifically, we're talking about research. We all have different mentors in our lives. I've had clinical mentors. I've had, education mentors. I've had, entrepreneurship mentors. I've had all sorts of mentors in my career. But here we're talking about research mentors. But the principles that I discuss here with you will be very applicable to other parts of your career as well. So here's the problem that most people don't understand. When you approach someone for mentors to become your mentor, usually people have this mindset of, how can this person help me? Like, let's say there's someone in your country who does a lot of research, or in your city who does a lot of research and publishes a lot, and then you want to work with this person. The most common pathway that people take to try to work with this person is go and ask for an opportunity because you want that person to help you. This works rarely, okay? People who do research are very sought out. Like, people really want to harass them. They ask for opportunities. They get bombarded with emails. I get tons of emails in my institutional email about people asking me for research. It's the same for everyone who does research. And what people are mostly doing when they do that is saying, how can you help me? But that's not the way you should think about this. So I want you to scratch this mindset when you look for research mentors. And I want you to think of, flip this around. Networking, guys, is about serving others. First, you're going to contribute. Then you will get something back. All right? So I'm going to show you how you can contribute. But before you ask for an opportunity, you will first create an opportunity for you to help that other person. First, you serve. That's how networking works really well. I'm going to show you a personal example and then some example of students. You guys won't be able to see it on the screen, but behind my chair here, there are some awards and diplomas and things that I've had during my career. One of those awards is this award right here. It's called the Randerson Cardoso Service Award. So I was the first person to receive this award at the University of Miami. And for almost 10 years now, they've been giving this award every year to the resident who contributes most to the program. It's still called the Randerson Nascimento Cardoso Award for almost 10 years. And they do this because when I was at the University of Miami, when I won this award, I contributed, I served, okay? So let me explain to you what I did. Just as this is going to be brief, but I think it's important for you to understand that you first serve and then you get a lot in return. When I was a resident, I've always loved to teach in my career, okay? So I was a resident at the University of Miami, and I did a lot of teaching. I got recognized, I got teaching awards, I got recognized for my teaching efforts. And when I was a chief resident, I built a curriculum of board for residents to pass their boards, the internal medicine residency boards. It's a really tough exam. And I helped the residents pass the boards by doing a board review course. They didn't pay me for it. They didn't ask me to do it. I volunteered because I love to teach and I know it would help the program. So this is an example of like offering that service, that serving others brought me back many, many things during my career. I got this award that's called the Randerson Cardozo Award. My program director really liked me. She was an advocate for me. When I applied for fellowship, she called program directors. She spoke very highly of me. She helped me get a really good match in cardiology at Johns Hopkins. But this is the type of networking that works really well. It's the networking where you first cause a good impression. You first contribute. All right? And remember, to serve people above you, a lot of times you can serve laterally. Like in my example, I helped the residents in the program, but the residents were under the supervision of a program director who really appreciated my work. So before you guys think of how can someone else help you, all right, you make sure that you put in the work, that you contribute, that you can collaborate. And meta-analysis give you an opportunity to do that. I'm going to show you an example here of Beatrice. Beatrice is a medical student. She's a 4th year medical student at the time she published this. But she had this idea. She did the method. She did the statistics. She came up with the project. And remember, how did she do this? By finding controversial topics in her area of interest, in this case, critical care. And she invited an attending at the Mayo Clinic in Rochester, Minnesota, Dr. Alice, to be her mentor in this paper, Dr. Alice Moraes. So this is a beautiful example of networking for research. You invite your mentor to your project. After you do this, opportunities may come up where this mentor will invite you for new projects, for research fellowships, for collaborations, for writing you a letter of recommendation. But the first thing you're going to do is develop the skills, come up with the idea, run the project, and invite a specific person to be your mentor. That person may be someone locally who's really well respected, who's really well regarded, or it may be someone international like Beatrice did, inviting Dr. Alice in another country, in another institution, to be part of her research group and her mentor. So these are examples, guys, where you first serve. You first serve, by the way, make sure to check Metacast with Dr. Alice. I think it's Metacast number 8. Okay? You first serve, and then you get something in return. This is another example. This one is from Jonathan from the UAE, from Dubai. He just sent me a message the other day saying that he had 2 papers accepted in the highest ranking journals in plastic surgery. He wants to do plastic surgery in the US. So he's a student of ours from the Meta-Analysis Academy, and he sent me a message saying that he got accepted in the highest ranking journals in plastic surgery. But Jonathan did something really clever. When he came to rotate in the US, he came to do 2 rotations here. He invited some of the attendings, I don't know if 1 or 2, I don't know how many, but he invited the attending in his rotation to join in on his work, to collaborate with his publication. So when you think about mentors, you first think about serving others. You do the work, you get the skills, you get the idea, and then you invite mentors to collaborate with you. And they'll help you. They'll make your paper better. They'll give you their clinical or surgical insights. They'll open up opportunities in your career. I could go on and on with hundreds of examples of people who've done this and then have gotten tenfold in return. Whether it's a residency position, a letter of recommendation, a research fellowship, a observership, whatever it may be. But first you serve. Is that clear to everyone? Yes? Is that clear to everyone? Everyone got that? Okay, so now that we've done the exercise and I've cleared this out of the way, the mentor part and the institution part, we're going to talk about the 10 steps to doing research publications with autonomy. Developing ideas is just the first step. Developing ideas is the first step. The next step is to do the 10-part process that I will explain to you right now. But before I do that, I am finally, after many requests, I am finally going to explain to you the details of the Meta-Analysis Academy. All the examples of meta-analysis that I've shown you here from people from all over the world, from Jonathan in Dubai, from Matteo in Italy, from Natalia in Colombia, all of these examples are students of the Meta-Analysis Academy. And I'm going to explain this to you in case you decide to join the program. If you decide not to join, I respect that. You can still follow the publication roadmap. You will have learned a lot. But I want to give you a good sense of how the Meta-Analysis Academy works so you can make the right decision for you. So the Meta-Analysis Academy is a 10-week program that explains to you in detail, hands-on, each step of doing a systematic review and meta-analysis. In our program, you're going to learn in much more depth how to develop your own research ideas, how to build the question, test viability, all these steps, including statistics, writing the manuscript, and submitting it. And we do the program 1 week at a time. The Meta-Analysis Academy works 1 module per week. So in less than 3 months, you would have mastered all the components of doing a meta-analysis, okay? The way the program is structured is for every single module, you will have a lecture, a recorded lecture, but then you would do an exercise, kind of like the exercise that we did, but in more depth. This exercise will train you on how to do the process hands-on. You will learn in the lab exercise for every single module how to do each step comfortably. You will learn how to do your own statistics. You will learn how to write the paper. You will learn how to test viability with the exercise. And after you've done the exercise, we have a special live session where I discuss the exercise with you. It's interactive, it's dynamic, it's really fun. And it happens on Sunday mornings here in the United States at this exact hour. So in this live session, in this CPT, we go over the exercise together. It's a live session, but it gets recorded, and you can watch the recording later if you prefer. You have access to the whole program for a full year, okay? You would have access to the entire program for a full year. All right, but we do those CPT sessions live. Every week, we do 1 module. And we're going to start this edition of our program right now, this week. So you're going to have an opportunity to join the Meta-Analysis Academy at the end of the roadmap. And if you do, you will run each class from end of September to beginning of December, and you will have access to the full program until August next year. That's how our program works. That's how the Meta-Analysis Academy works. It's my lecture, then you do the exercise, and then we do a live session every week called CPT, okay? Curricular Practical Training. It's a live session on Sunday mornings in New York, but it gets recorded, so you can watch it from any time that you want. Okay, so it's a Zoom session, the CPT. This is an example of our statistical exercise. Okay, in this statistical exercise, you will learn how to build the forest plots. You will learn how to do every single step of the process. Okay, and we're going to kick off next week with our CPT number 1, and I hope to see you guys there. We have tons of tutoring sessions. These are optional. You don't have to come for them. This is just to help you in your projects, help you in your research, help you in your statistics. So I do tutoring sessions, and we have brilliant tutors who would help you as well. We have tutoring sessions in English and in Spanish for those who add on the Spanish version. Okay, so These tutoring sessions are there to support you, to help you in your own projects, or if you have any questions about the exercise. You can come and ask questions directly to me or any of the tutors, okay? And it doesn't matter where you are from in the world. The program is structured for you to have success, like this publication in orthopedics. Marian is from Romania. We have students from our program in this paper who are from Argentina, Indonesia, Azerbaijan, all over the world, okay? So this program works regardless of your level of training, regardless of the country you're from. We form great research groups. This is a research group that has folks from multiple different countries. And you can also apply to our incredible experts program. And the experts program is part of the Meta-Analysis Academy, where you get to submit your idea to a worldwide expert. These are just some of the experts that we've had in prior editions, like a cardiac surgeon from Texas, a radiologist from Stanford, California, Dr. Outmeyer. All these worldwide experts, you get to submit your ideas to them, and if they're interested, they may collaborate with you. These are some of our students presenting all over the world in worldwide conferences. Jaime is from Chile. Renata is a resident at Harvard in otorhinolaryngology. Tamidis is an ENT resident in Brazil, and all of them met in the Meta-Analysis Academy. They've presented at a conference together in Miami. They've published this great paper together. These are our experts program. Susimar is from Costa Rica. Rafael is from Germany. Mariana is from Brazil. Lara is from the US. So these are multicultural, international collaborations that you form. So that's all I'm going to say about the Meta-Analysis Academy. I can answer more questions later, but I will say this. If you want to join, make sure to join this early bird registration group. Registrations are going to open tomorrow morning on Monday, 7 a.m. New York, midday London time, but only for those who are in the early bird registration group. Only for those who are in the early bird. After a few hours, we'll do open enrollment for everyone, but the first block of enrollment with the special conditions, with some really special bonuses too, would go for those who are in the early bird registration group. Okay, so I hope to see you guys there. Make sure to join, and also make sure to register at exactly when registration opens. If you can, you will win some special bonuses by being in our early bird group. Okay, so that's it. Make sure to join there. Our team will put the link here. Oh, the fee structure, I will talk about it at the end. Okay, so Waka's asked about the fee structure. I will explain the details on costs at the end. I'm going to ask the team here to put the link in the chat. Please, link for early bird in the chat. There we go. They just put it there. In case you want to join, just click this link and you'll be able to join the group. Guys, one final thing about security, okay? Don't accept individual messages from someone claiming to be from our team without first verifying that they're a trusted number. In the transmission webpage of the publication roadmap, there is a checker. There is a place where you can check whether you're talking with a verified number. Okay, so if someone sends you a direct message saying, hey, I'm from Dr. Anderson Cardozo's team, they may be. All you need to do is just check that you're actually talking to someone from our team and not someone who's trying to scam you. Okay? All right, you guys can always send me a message directly. If you go to our Instagram page at metaanalysis.academy, it's a verified account. You can actually just send me a message and I'll answer you any questions you may have. Okay, so that's our early bird group. All right, guys, let's move on. Okay. Let's talk about these 10 steps to do research publications with autonomy. Okay, let's go ahead and do this. So these are the 10 steps. It's the same steps that we teach in the Meta-Analysis Academy. We already learned how to develop ideas, so we're going to go quickly through each of these steps. The goal here is to give you an overview of all of them, but of course, in the Meta-Analysis Academy, you would learn how to actually do each of these steps. So step number 2 is to build a P-code question. Let me show you this with a very practical example. This is a publication by Arthur in plastic surgery. Arthur is a resident. He's super busy. He works 1,000,000 hours a week, but he did the program as a resident. He published this great paper as a resident. So the paper is on lymphovenous anastomosis for prevention of breast cancer lymphedema, for prevention, okay? And this is the P-code question. The population here is women with breast cancer who had axillary lymph node dissection. This is the P. P means population. Who are the patients in the study? The intervention in this case is to do immediate lymphovenous anastomosis. The control group is without lymphovenous anastomosis. And the outcomes are incidence of lymphedema, seroma, hematoma, infection, or reoperation. Essentially, complications of the surgery. All right? And then the T means type of study. Okay? Sorry. T means type of study. So T, in this case, the type of study that Arthur and his group did, of course, they're students of the Meta-Analysis Academy. This type of study is a meta-analysis of randomized control trials and observational studies. Okay, so that's what the T means. So PCOT means population, woman with breast cancer. I, with lymphovenous anastomosis. C, without. Outcomes. And then T, type of study. Why is it so important to build the P-code question? Because it serves to organize your ideas. If you guys look at the exercise you guys did, or the notes that you took on potential ideas, you will see that those ideas in the beginning, they're very vague. They could be things like, oh, I'm interested in evaluating the need for a drain in patients who have left pancreatectomy. It doesn't have very specific parameters. When you put it in a P-code format, which is step number 2 of the process, what happens is you give it shape and form. So the step number 2 is to build the P-code question after you develop your idea. Let's go to step number 3. Step number 3 is to test viability. What does that mean? Okay, so this is an important concept I have to explain to you. So, has anyone ever gone through the very frustrating experience of working on a research project for weeks, months, sometimes years, and it never got published? Has that ever happened to anyone? Yes? Let me know in the chat, okay? Let me know in the chat if you've ever done that, okay? If you've ever worked through years, months of research work and it never got published. That happens all the time. And the reasons why this happens is because it could be many, but it usually it boils down to one thing. Usually it comes down to the fact that primary research takes a very long time. The results are uncertain, and you depend on other people. So the reasons why projects could fail would be any of these, like your mentor moved, your mentor disappeared, is not interested in the project anymore, or it just took so long to collect the data and the results were not interesting. That's another possibility. Or it just takes such a long time. By the time the project was done, you had moved to another institution. Okay. So that's a huge risk when you're doing research, is to waste precious time doing low value things or uncertain things. When you do a meta-analysis, you can avoid this by testing for viability. Viability is the simple concept of identifying very early on if your idea is good enough to be published. That's it. Within a few hours of work, 3, 4, 5, 6, 7 hours, within a few hours of work, you're able to identify whether the idea and the clinical question that you had, whether it's viable or not. And if it's not, I like to use the term that idea is dead on arrival. So I'm going to explain to you what this concept means if you're not familiar with it, because I think it illustrates very well the concept of viability. So in countries like the United States, where there is a two-party political system, like over here, there are Republicans and Democrats. In other places, it may be conservatives and liberals. So in this two-party system, oftentimes, or all the time, there is a majority in power and a minority, okay? So like right now in the United States, Republicans are majority and Democrats are minority. Let's say that the Democrats have an idea of a project, but the Republicans are really opposed to it. So the Democrats would then create a project, a proposal, but they're minority. So the minute they bring that proposal to the House or to the Senate, wherever it may be, it's already dead, even before they vote. It's dead on arrival. The minute that idea was born, the minute they had that idea, it was already dead. It's dead on arrival because they're a minority. They don't have enough political support to get the idea approved, to get that project approved. Well, the same concept applies here in meta-analysis. So you may have an idea and you think it's great, but when you go test viability, you realize that it's dead on arrival. That the minute you had the idea, it was already dead and you just didn't know it yet. But when you test viability, you found out that it was dead. And on the other hand, if your idea is not dead on arrival, if it's viable, then you're really confident that you know your results will be published. So testing viability is a beautiful thing in meta-analysis because it allows you to very early on in your project, decide if your project is viable and you're going to publish it, or if it's dead on arrival and you have to give up on it and work on something else. So this concept is extraordinary. If you learn how to test viability well, you're going to save hundreds of hours. You would never work on a meta-analysis to find out at the end, weeks later, that it's dead, that you can't publish that paper. Okay? So how to test for viability? You have to have at least 3 studies on that topic to add in your meta-analysis, and it has to be novel enough. Novel enough means that your meta-analysis is either the first one on that topic, or if there's already a prior meta-analysis, that you can modify it substantially. And learning how to test and create and adjust viability is one of the most important skills that you guys can have in doing meta-analysis. Okay? Because if you don't know how to do it, you're either going to waste time doing projects that are dead, or you're going to give up prematurely on good ideas. So you have to become really good at testing, adjusting, creating viability on your projects. Okay? And if the project is dead on arrival, you would give up and look for another idea. But first, you're going to work on trying to create viability. And that's exactly what we teach in class 3 of the Meta-Analysis Academy. You can be creative. You can modify the PCOD question. You can add new studies. You can modify an element of the prior meta-analysis. There are tons of creative ways of creating viability. And sometimes the projects really are dead on arrival. But you have to have that skill set. Otherwise, you waste so much time on pointless, useless projects. And that's what we teach in class 3 of our program, how you can get really good at testing and creating viability in your projects. Once you determine that a project is viable, Only once you determine that it's viable, you will then cast out your net into the literature looking for studies that fit your P-code question. So let me show you an example of how to do this. You guys saw this prior publication by Thomas. Thomas is a resident at the University of Colorado. He published in the British Journal of Hematology on anticoagulation versus aspirin for prophylaxis in patients with myeloma. If he were to do a search strategy in PubMed just with the word multiple myeloma, he would get 62,000 results. This would be too broad of a search. But if he were too specific, if he created a search strategy like this, then he would be too narrow in his search. He would only find 5 results. So in step number 4, in building a strong search strategy, you have to become very good at finding the right balance between a search strategy not being too broad like this and not too narrow like this. And there are tools for you to do this. Tools to build great search strategies like Boolean operators, parentheses, quotation marks, highly sensitive Cochrane filters, and mesh terms. These are tools to building great search strategies that are neither too broad, nor too narrow. And that's exactly what we teach in class number 4 of the Meta-Analysis Academy. How to use the right tools to make your search strategy just the right balance. Once you build really effective search strategies, you would go and apply it to the medical databases, to PubMed, to Cochrane, to Embase and Scopus, and that's step number 5. Now that you've done this search in the medical databases, you have to go through screening. What is screening? Screening is going through the 1,000 results or 600 or 700 or 1,200 results and finding out which are the studies that you want to include and which are the studies that you want to exclude from your systematic review and meta-analysis. There is a process by doing this. It won't be manual. You won't have to go and read every single study to decide which one gets accepted and which ones get rejected. You will use software for this, and we'll teach you these software in the Meta-Analysis Academy, like Zotero, for example, like Ryan, for example. We will use these software in the Meta-Analysis Academy, and this will ultimately help you do your triage more effectively. All right, we're going to take a pause here and talk about time, because you're looking into this and you're saying, this is beautiful. This is fantastic, but how am I going to find the time to do this, to learn the meta-analysis with Professor Anderson? How am I going to find the time to doing these projects? And here we have to talk about the barrier of time, because the process itself is very doable. It's reproducible. Everyone can do it as long as you learn how to do it. But you have to really commit to it. You have to commit to it. And here, I want to show you why and how you can do it. Why you should do it and how you can do it. First thing is, your priorities are upside down. They may be upside down. If you don't understand how important research is for you in your career, then your priorities are just wrong. It's very common for medical students to waste time on doing extracurricular activities that have little or no value, wasting all their time, and not putting the effort on research, on impactful publications. And they only realize it when they're a resident, when they're an attending, and then they've lost an incredible opportunity of having a super successful career. So your priorities may be upside down if you don't realize that research is really important for you. And I can't fix that. You have to just realize that doing impactful first author publications will be transformative for your career goals. The other thing that's wrong with your time management is that you're wasting time, many of you, wasting time on doing low value stuff like case reports. Once you do one or two, it doesn't really add anything at all to your CV. It adds little or no value. So case reports is something you should get rid of and work on something else. It's just a waste of time. Now, if you're doing a cohort study or a clinical trial, those may be good, but they take so long. It takes forever to do an ethics board and collect data from charts and recruit patients. So you have to think about time-effective ways of getting great publications, and meta-analysis are a great way of doing that. Remember, what takes time, do you think? Is it recruiting the patients for the primary studies, or is it doing the aggregate analysis of all of this? It's the primary study, guys. That's where the time is. That's where the time sink is. Now, those primary studies are very important, obviously, and you may even work on some of them too. But if time is a major issue, you have to prioritize what is faster, more effective, and what gives you more results. Like today, I helped to run a clinical trial. I'm principal investigator in a multi-center, I'm local principal investigator in a multi-center clinical trial. I do primary studies today, but it's taken me 1 full year to recruit 7 patients. It's a nightmare in terms of recruiting and taking time and filling out paperwork. It's so painful. But I've never stopped in my career doing meta-analysis. So if you're busy for time, first of all, if you're busy in terms of time, first of all, stop wasting time on case reports. Second, prioritize time-effective ways of doing research, meta-analysis, okay? So if you were to do a clinical trial, you have to go through a protocol, ethics board, recruitment, collecting data, following patients, collecting data, analyzing the data, writing the manuscript. It just takes years, months at the very least, and you can't even test viability. You don't know if the project is going to work out. You have to invest 6 months, 1 year, 2 years before you find out if you're going to have a publication at all. Okay? What about a meta-analysis? How long do you guys think it takes to do a meta-analysis? Tell me in the chat. How long do you think it takes to do a meta-analysis? The answer is, on average, 2 to 9 weeks. 2 to 9 weeks. It depends on the size of the meta-analysis. Okay? This one here, Lucas and his group did in 2 weeks. It's published in Anesthesia and Analgesia. Obviously, it's not the average. They did it really fast. They were already really, really good, very well trained. This was a great team working together. And it was his first publication. It was his first paper. He did it in 2 weeks. Obviously, he learned how to do it very well in the Meta-Analysis Academy. And you're not going to do yours maybe in 2 weeks, but on average, 5 weeks, 7 weeks, 6 weeks, 8 weeks, 4 weeks. It's variable, but it's also very fast. Very fast. And the beautiful thing is that in the Meta-Analysis Academy, you're going to learn to be the best in the most time-efficient way possible. Guys, doing 1 lecture, 1 exercise, and 1 CPT per week for 10 weeks. It doesn't get simpler and more effective than that. Plus all our support, tutoring sessions to help you. So if you don't have time, invest the little time you have in things that will give you return on time invested. Learn how to do meta-analysis, learn it quick, learn it well, and do great work. Like Paulo, this guy here is a resident in orthopedics. He works like 100 hours a week. He did the course as a resident in orthopedics, and he published as first author in Arthroscopy, a great journal in ortho. Franz is a resident. A first-year resident. He published this great paper in heart rhythm. He's from Ecuador. He's a first-year resident. He won an award. Because he's doing great research. What type of research? Meta-analysis. So lack of time is not an excuse. Wasting time is the problem. Wasting time on pointless research efforts, that is the problem. Okay? So we've done study screening and selection. Now we got to move on to data extraction. What exactly are we extracting? Well, we're extracting data from the individual studies. All right? All right? This is look at this comment from Aisha, guys. I can't believe it only takes about 2 to 7 weeks, 2 to 9 weeks. Aisha is working on her project for 4 months. 4 months stuck on ethics committee approval. That's so common. That's so common. This happens all the time. With meta-analysis, it only takes a few weeks to get the project done, and you can find out within 1 day of work if it's going to be publishable or not. You can find out within 1 day of work if you're going to have viability or not. Okay? Now, just to be clear, I'm not saying any of this is easy. Like, you can't just go on YouTube and learn how to do this. Of course, it's not easy. But of course, you're going to learn it like everyone else that I've shown you here did. I've probably shown you more than 50 examples yesterday and today already. There are thousands like this of our students from all over the world. So you're going to learn how to do it. And you're going to become good at it. And that's how you're going to do it fast. Okay? Okay, so let's wrap this up. Let's talk about data extraction. Look at this publication from Mariana. Mariana is a medical student from northeastern Brazil. She published in the European Journal of Cancer as a medical student. Can you believe it? But what is exactly this step? What is the step of data extraction? Look, this is one of her statistical analysis. This is the statistics on post-operative complications. These numbers that you see on the screen, guys, Mariana and her team, they had to go and extract it from the individual papers. Like, you have to go to the clinical trial and get the 42, the 368. You have to get these numbers. Okay, so data extraction means going into the individual studies and pulling out the information that you need. Which studies? The studies that you've selected. You've selected the studies in step 6. And in step 7, you extract the data that you need from them. Which data? You're going to extract the data that you need to do the statistical analysis, which is the next step. And when I say statistical analysis, you think that it's impossible. You think that you could never learn how to do this. You think that you have to do math. You think that it's impossible to learn. Well, the truth is, you're not going to learn how to operate the formulas. You're going to learn how to operate the software. And we'll teach you that in the Meta-Analysis Academy. We'll teach you R, we'll teach you Review Manager. And in this edition, we're actually going to add on Stata as an option as well. So you're going to learn how to do statistical analysis with us. And then you're going to learn how to write the manuscript too. Oh, on statistics, every single example that I've shown you, the statistical analysis were done by our students themselves. None of our students, as far as I'm aware, none of our students have hired external help in statistics because they couldn't do it themselves. They learned how to do it in our program. That's what we teach in class 8 of the Meta-Analysis Academy. We teach statistical analysis. Class 9 is about writing. And I'm going to give you a few practical tips. We have a very in-depth training program in the Meta-Analysis Academy on writing, but I'm going to give you a few practical tips on how you can write better starting right now. Okay? So 1, remove the word that. A lot of times you can omit that and the sentence will still be very clear. So don't say the article that I wrote. Just say the article I wrote. It's a lot better. The other thing, be concise. Be concise. This is super important. It is important to highlight that patients randomized to aspirin had a higher incidence of bleeding. Don't say that. Don't say that. Just say this. Patients randomized to aspirin had a higher incidence of bleeding. Remove unnecessary words. Remove unnecessary statements. Be concise. Okay? Use the active voice. This is another great teaching point. My first research award will always be remembered. Don't use that passive voice. I will always remember my first research award. Okay? If you're writing a paper, you can use we. We used our software for statistical analysis. Use that active voice. Okay? You can use a little bit of passive voice, but just a little. Make sure that your paper is predominantly, almost entirely in the active voice. All right? So that's step number 9. Step number 10 is to pick the journal and submit your paper. All right? So right now we have to talk about an important component of publication, which is funding. Funding, the money that it takes to do research. If you're doing a clinical trial, it could cost a lot. I think the ischemia trial, for example, in cardiology cost $100 million. So obviously, larger multi-center clinical trials will require funding from government or industry. What about when you're doing a meta-analysis? Well, the cost to conduct a meta-analysis, guys, software, zero. You can do it all with free software. You don't have to pay anything. There are paid versions, but you don't need them. You don't have to pay anything for software. What's the cost to recruit patients in a meta-analysis? Zero, because you don't have to pay for patient parking. You don't have to pay for their meals. You don't have to pay for advertisement. The patients were recruited by the individual studies. You're recruiting the studies, not the patients directly. So that also doesn't cost you anything. If you needed to hire a statistician, at least in the United States, it would cost you $2,000 or $3,000. But you won't. You will learn how to do the statistics yourself. It's quite simple. So you don't have to hire a statistician for that. What about the publication charges? So this is another one we have to talk about. People think that you have to pay $3,000, $4,000 to publish your paper, but you won't. You're not going to pay anything, and I'm going to explain to you how. Okay, listen up. Let's talk about authorship publication charges. Generally speaking, guys, there are 2 types of journals. Actually, I'm almost done here, but I'm going to stop here because this is super important. Are you guys with me in the chat? Let me know in the chat if you're still on, if you're still excited, if you're motivated, if you want to publish these papers, if you want to learn how to do meta-analysis. Yes? All good? Good. Should we stretch? It's been a long morning. How long have we been here for? Oh, no, we're good. 1 hour and 20? No, we're good. We're almost done. We only have about 15 minutes left. Okay? But this is really important. I wanted to pause. You guys are amazing. What a great group. What a fabulous, fabulous group. Guys, since I paused this, I'm just going to ask you for a super favor. We're going to leave the recording of the publication roadmap on for about 24 to 48 hours. I'm going to ask you guys for a super favor to invite all your friends to watch it. Okay? As it's a ton of work to do this, I recently had a baby. I could be spending time with the baby. I have everyone here from the team in the background. Everyone's here on Saturday and Sunday with you guys. It's a ton of work. We prepare a lot for this. So do us a favor, do me a favor, personal favor, and share this with all your friends in your universities, in your program. Tag us on social media, in your WhatsApp groups. Okay? Thank you, guys. Thank you so much. Share with all your friends. So that they can watch it as well. Okay, it's in. We're gonna send you the link for the transmission page that has day 1 and day 2. Okay, so I'm gonna ask you guys for that favor. All right, so let's finish this up. There are 2 types of journals. 2 types of journals. Okay, when you submit your paper for publication, you could pick a journal that's open access or subscription based. Open access means the authors pay a fee for publication, and then the readers can access it for free. That's why it's called open access. But there are other types of journals that will not charge the authors. These subscription-based journals will charge readers for access to the papers. As you can imagine, the subscription-based journals are much harder to get published in because they're really high-ranking journals that only accept very, very good papers, and then they go and sell those papers to their subscribers. So it's very hard to get published in subscription-based journals because you don't have to pay a fee. The journals have to be really good quality. The papers have to be really good quality. Now, this is obviously, I'm being generalizable here. I'm generalizing the topic. There are open access journals that are very good too, but generally speaking, subscription-based journals are far better, but also harder to publish in them. And then these open access journals, if people want to publish there, they have to pay on average $3,000. Sometimes it's $2,000, sometimes it's $4,000, but it's quite expensive to publish one paper. So what's the solution around this, guys? The solution is that you have to publish such good research, like the ones I've shown you throughout the last 2 days. You have to publish such great research that your paper is qualified for a subscription-based journal, that you don't have to pay an open access fee. So that's essentially it. You have to do such a great job in your paper that you don't submit to an open access journals. And the way to do that, look, meta-analysis, 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 meta-analysis. And a way to do that is for you to learn how to do meta-analysis. All of these are students from our program. These publications, the first authors and many co-authors, are students of our program, okay? And if you learn how to do this, your papers will be such at a great quality that you would qualify for the subscription-based journals. Like Rafael. Rafael was a third-year medical student. This is such a great story. This is such a great story. Rafael was a third-year medical student. He knew nothing about research. He didn't know what a p-value is. He didn't know what was a confidence interval. He was so clueless. I'm saying this publicly because he said it publicly in a live stream that we did. But he joined the Meta-Analysis Academy. And then he published on conservative or surgical management of flail chest. How much did he pay for this? $0. It's not an open access journal. He didn't have to pay anything for this. But look at how cool. 2 years after he published this, he was in class. And then one of his professors was talking about surgical treatment of flail chests. And the professor put up this paper, but he didn't know that Rafael was his student. So Rafael was in class. The professor was teaching them about flail chests, about management. And the professor projected his paper and started talking about the meta-analysis because there's such high quality evidence that they're used to inform practice. At the end of the class, Rafael walks up to the teacher and says, "Hey, professor, I'm the author in that paper. I'm the first author." Can you believe that? Can you believe it? And this has happened to our students even in conferences. You're watching a conference presentation and someone puts up your own meta-analysis to support the point they're trying to make. So all you have to do is avoid open access journals like these. These are open access journals. They'll charge you a fee, an expensive fee to publish. Not all open access journals are inferior quality, but most of them are, okay? So the cost to conduct a meta-analysis is $0. The cost to publish a meta-analysis is $0 if you avoid open access journals. So this is your prize. You do such high quality work, you do such great publications that you don't pay for software, for statisticians, for authorship publication fees. But to do that, you need to have quality. You need to have impact in your research, okay? And that's what we teach you, of course, in the Meta-Analysis Academy. The last thing I'm going to say, I think we've broken all these barriers. We've talked about statistics. You learned that in the academy. We talked about institutions. We've talked about mentors. We've talked about funding, the skills you're going to learn in the Meta-Analysis Academy, and the time we talked about. So the final thing I'm going to say is about research groups. It's about connections. And here, I want to talk about this word that I've mentioned a few times, which is autonomy. I've talked about developing autonomy in your research multiple times. Develop ideas with autonomy. Do research with autonomy. Learn the skills yourself. But I want you to understand that autonomy does not mean doing it alone. None of the publications that I showed you had just one author. So autonomy does not mean doing it alone. What does autonomy mean? Autonomy means that you have control of the process yourself. It means that you know how to develop the ideas. You know how to do methods. You know how to do statistics. You know how to write the paper. You know how to find your mentors. Autonomy means you have control of that process. You don't depend on your institution, on your ethics board, on your professor, or on your co-authors. You don't depend on anyone. Now, a great research group helps. Of course it helps. You know, I mentioned this in our WhatsApp group, but I'm going to explain this story for you guys for you to understand. Isabella with an S and Isabella with a Z joined the Meta-Analysis Academy together. They were friends before. They joined the Meta-Analysis Academy together a couple of years ago, and since then, they have several papers together. Sometimes Isabella with an S is a first author and Isabella with a Z is a co-author, and sometimes it's the other way around. So having a strong network of collaboration will really, really help you. But those folks don't need to be in your university. They could be anywhere in the world because the data is not from your institution. The data are yours. So Isabella was a med student in Spain at the time. She's now at Harvard as a research fellow. Isabella with a Z was in Russia at the time as a medical student, but they've collaborated on multiple papers in pediatrics and dermatology. Here's a publication in dermatology too. Actually, both Isabellas are also there too, but look, it has students from our program, from Brazil, from the United States, from Russia, from Spain, from the UK. So these are students from all over the world who've connected in the Meta-Analysis Academy. You will form a network within our program. You will meet good people, but the first and most important point is that you learn the skills. You have to learn the skills. I've showed you guys this group before, this group in ENT. But again, the reason why the group works so well is because they all know how to do the steps. Jaime is from Chile, Tamir is from Brazil, Renata from Harvard, Bruno from Brazil. So this is a great group in otorhinolaryngology, but they know how to do the research together. And that's what's going to happen in the Meta-Analysis Academy. You learn the skills, you have the support, and you meet your research groups. This does not depend on your specialty of interest. I've shown you examples on multiple different specialties, but you can look in the screen and see your specialty of interest. You may like genetics. You can publish in genetics. You may like OBGYN. You can publish in OBGYN. You may like nephrology. I don't know why you would like nephrology. You know, I'm a cardiologist. We have this thing with them. But I'm just joking, of course. But with nephrology, you can also publish in the best journals in nephrology, like Blood Purification. Maria published in one of the highest ranking nephrologist journals in the world. So these are all our students. These are all on PubMed. You guys can check all of these publications out in radiology, in rheumatology, in pediatrics, in pathology, whatever it is. So how to find people in the Meta-Analysis Academy. These are all groups, research groups from the Meta-Analysis Academy. Okay? These are all people that connected with each other within our training program. And this works regardless of your country of origin or your medical school. So look, Meghna is from India, published a great paper in the American Journal of Otolaryngology. Sarah is from Pakistan, published in the Journal of Cataract and Refractive Surgery. Esther is from Paraguay. She just matched into cardiology at the University of Texas. Emre is from Turkey, published in the Journal of Minimally Invasive Gynecology. Okay, Susimar is from Costa Rica, published in Cardiac Surgery. Fateme is from Dubai, published in the Journal of Pediatric Surgery. Okay, so that's the Meta-Analysis Academy. Let's talk about the fee structure because you guys asked for that, and then we'll be done for today. Okay, let's talk about the fee structure of the Meta-Analysis Academy to join. Now, the price, if you're watching the recording later on and the price has shifted, if the price has gone up, it's because this is a special offer for the publication roadmap. Okay, so I just want to leave this on the recording in case anyone catches the recording later on. This is a special offer for the publication roadmap. Okay, so before I tell you the price and the fee structure, how much do you think these skills are worth in your career? How much do you think they're worth to you? Because one thing is the fee and how much it costs. The other thing is the value. Okay? All right? So, Bezalel is from southern India. Bezalel had no research experience. He won a $2,000 research award from the International Society of Thrombosis and Hemostasis. $2,000. He came to the US, presented his conference at the conference in Washington, D.C., stopped in Boston to say hello, went back to India. He won $2,000. Okay? So Carlos got a research fellowship at the University of Michigan in radiology because he had such a strong CV. So his salary there is probably $50,000 or $60,000 or $70,000 per year doing research at the University of Michigan. Mangesh is from India. He's doing a research fellowship at Houston Methodist in Texas. How much do you think these skills were worth to him? Like in terms of value? At the very least, his salary as a research fellow, I don't know what his salary is. I would guess $60,000, $50,000, or $70,000 per year as a research fellow. So if you are interested in coming to the United States and doing a research fellowship, for example, having these publications like Mangesh is critical. Critical for you to really advance your career, for you to get a position, for you to match into residency. So how much are the skills worth to you is something you should consider before looking at the cost. How much do you think these skills were worth to Luca? Luca won a scholarship at Johns Hopkins to do a master's degree, and this master's degree would typically cost $80,000 or $70,000 per year, but he won a scholarship. He didn't have to pay a single penny for the master's degree at Johns Hopkins. So the true value for your career, it just can't be measured. Okay, we talk about these numbers: $80,000 per year, $60,000 per year, a $2,000 research award. But the true value in career opportunities cannot be measured. How much do you think it was worth for Natalia, who matched at the University of Miami for neurology? How much do you think it was worth it to her? Or for Denilsa, who matched from Mozambique, matched at the University of Nebraska? How much do you think it was worth to her to learn how to publish these papers? It's priceless. Or Caroline, who got an observership at Harvard as a third-year medical student. Remember, guys, this publication roadmap has no affiliation with these institutions, okay? It's not affiliated with Harvard, with Nebraska, with the University of Miami. It has no affiliations, the publication roadmap. Or what do you think it was worth to Sarah? Sarah is an anesthesiologist. She's from Portugal. She had a career in Brazil. And then she's now doing a fellowship in regional anesthesia at Duke University in the United States. And she will be an attending here. She will be an attending at Duke University. How much do you think these skills were worth to her? Okay, so the price for you to join the Meta-Analysis Academy is the following. We break up the payment in 12 installments. We do this so that you don't have to pay a larger amount up front, so it's easier to fit in everyone's budget. So we offer the possibility for you to pay in 12 installments. That's not a subscription, it's an installment. You pay every month for 12 months, $200 per month. But that's the full price. We generally give folks a discount, and we're going to give a discount for the publication roadmap. So if you join the Meta-Analysis Academy here in the publication roadmap in the early bird registration group tomorrow, the tuition fee will be 12 installments of $130 per month. 12 installments of $130 per month. You can pay it all up front. There's an extra discount. There's an extra 10% discount. But if that can't fit in your budget, you can just pay every month $130 per month for 12 months. Okay? To do this, to get this special offer, you have to join the early bird registration group. Okay? The link will be sent there tomorrow, very sharp at 7 a.m. New York, midday London time. So the tuition fee will be 12 installments of $130 per month. Okay? And you would pay that for 12 installments so that it's not a burden on your financials. Okay? You just pay a smaller fee every month. And this is the link for you to join the early bird group and get access to this special offer. As promised, we're also doing a scholarship. We're going to do actually 2 scholarship awards for people who followed the instructions that I gave out yesterday. The first one will be among those who fulfilled, who finished, who completed the exercise before day 2 of the program, before today. And the second one would be to those who are here watching live. Okay, so if you're watching live here and you did it yesterday, what you're going to do right now is you're going to go to Instagram. You're going to tag, you're going to post any picture of the roadmap, any picture that you would like. It has to have the name publication roadmap. And then you just tag us on Instagram at metaanalysis.academy. And then you have to send us a direct message with the word MAA. MAA. You have to send this direct message on our Instagram at metaanalysis.academy. Right now is 8:40 New York time. 8:40. Okay, 8:38 to be more precise. At exactly 10 a.m. New York time, in 1 hour and 20 minutes, I will be live on Instagram. And I will do that drawing for those 2 scholarships. Okay? So again, and I'm also going to answer questions about the Meta-Analysis Academy. So if you have any questions about the Meta-Analysis Academy, how it works, how you can make the payment, I've already explained a lot here, but I realize you may have additional questions. If you do, all you have to do is show up in the live stream, put your question in the chat, and I will answer you there. Okay? All right, you guys can also send me a direct message if you have any questions. And right now, all you have to do is join the early bird registration group to get access to this very special offer of 12 installments of $130 per month. Okay? Guys, it's been real. It's been great to be with you. Oh, people are asking about the discount for upfront registration. So yeah, if you pay upfront, there's an extra 10% discount. So I can tell you exactly how much that would be. It would be $1,400. Okay, you get an extra 10% discount. By the way, guys, we also have a Spanish version. You'll be able to add that on at checkout. You'll be able to add that on. And we're also going to have our ECG Academy, our ECG training program as an option, as an add-on. Okay, each of those will go on for a special fee also, much, much cheaper at a discount price than what they cost if you add the Spanish version of the program or the ECG program. Okay, all right, so 12 installments of $130 per month. All you have to do is join the early bird registration group. Okay, I'm gonna end here for now. It's been so great to be with you guys. If you have any questions about this, I'm gonna be live on Instagram in 1 hour and 20 minutes, and then you can send me a direct message as well. Okay, it's been real. You guys have a good one. It was great to be with you all for the publication roadmap. Have a good one.
I'm Cynthia. I just matched in internal medicine in a program in Colorado. My application is not considered strong. I didn't have a visa. I had a fail in the step 2 CS. I was considered an old graduate because I graduated in 2017. I had applied last year and I had only 2 interviews. And this year with the publications, I got 8 interviews and the match came. So I have 7 meta-analyses published and 12 abstracts, or even more because at some point you just stop counting. I got these publications in 1.5 years, but definitely didn't have research experience before. Meta-analysis community is one of the best things you can get from the meta-analysis course. I not only got the publications, but the networking allowed me to get also rotations in the US with attendings there in academic institutions. Because of that rotations, I got some letters of recommendation from the clinical rotations. Also, my main meta-analysis, the senior author wrote me a letter of recommendation. So those letters, I'm sure that were much more strong than I had previously from like paid observerships and private practices. It really helped me to build up a strong applications for this year.
I've published 10 papers and had over 20 abstracts accepted at international conferences. Recently, I got an invite to do an observership in Beth Fisher Deaconess Medical Center at Harvard Medical School with Dr. Andre Davila, who is chief of electrophysiology in that institution. I connected with Andre Davila after I finished one of my meta-analysis and decided to invite him by email to collaborate on this project. I'm not an electrophysiologist, but this was one of my ideas. I developed it through one of the Meta-Analysis Academy methods.
I'm Rafael Lombardi. I did the first class of the Intensivo de Metas, and I can tell I'm assistant professor at the University of Nebraska Medical Center, anesthesiology, and I had amazing results with Dr. Rando Sugardoso course. He really taught everything you ever need to know about systematic reviews and meta-analysis. My experience on research before doing this course was minimal. I had 2 small experimental papers published during med school that was no better than anything you might ever imagine, so I surely can tell my experience with the research was 0. And after doing this course, in 18 months upon my enrollment in the course, I was able to have 3 papers accepted for publications in major journals of anesthesiology, and I really lost track of how many presentations in national meetings. I had 3 papers presented in American Academy of Medicine meeting, 5 presentations for ESRA meeting, some presentations accepted for word meeting of regional anesthesia. I really don't remember how many, but it was 3 or 4. And I had some more presentations accepted for ASA meeting of this year, 3 or 4, don't remember how many. I really lost track of how many papers accepted for presentations in national meetings. So the course is amazing. Rando is going to teach you everything you ever need to know about systematic reviews and meta-analysis. It's going to improve your CV. It's going to make your CV way better. And if you intend to apply for residence over in America, definitely this is going to boost your curriculum a lot. And maybe you'll be able to have a view like the one I'm having today.
Before the academy, I had never even thought that it would be a possibility for me as a medical student to go to a conference of that magnitude, let alone present an abstract at it. So it was amazing. I felt amazing. It was very exciting. And I met other people from the academy there. I watched their presentations. They watched mine. And Dr. Randerson was there and he watched my presentation. And to me, his best quality is this one. He is available. He is such an available teacher and he makes things so much easier because of that. And he's such a humble person. And he is all that, guys. He is all that. And if you have the chance of joining the team, do it, because it is a life-changing experience when you see that some things that you had never dreamed that would happen start happening.
As a 50-year medical student, you don't feel that very important to the medical field. I just came back from Atlanta, where I presented in the ACC 24, my abstract as a first author. When I received the email, I was very surprised. I didn't even realize it was possible. I learned how to do meta-analysis with the Meta-Analysis Academy. All the classes and all the support that the course gives to you was essential to my learning of the study design, the meta-analysis, to give me independence in producing scientific content.
Before the Meta-Analysis Academy, I didn't have any publications. Recently, I had one abstract accepted for a presentation on American College of Cardiology. Currently, I have 13 abstracts accepted in international conferences and 2 papers published, one of them as first author at GMT+1. In the course, you learn the step-by-step process to perform high-impact research. I think one of the highlights of the Meta-Analysis Academy is the community, because you get to be surrounded by such amazing people that have the same goals as you. So it gets easier to really dedicate and to try to do your best every day, because you see that other people are doing their best. So it's really encouraging and it's amazing. It's a great experience. Yeah.
Right now, I have 3 PubMed Index publications, 10 abstracts, and 7 under review papers. Always wanted to learn research, and it has been something that I'm passionate about. And I discovered even further that I'm really passionate about it and want to do this in my lifetime because of Med Academy and the opportunities that have been open to me, because I never thought they would be possible.
I have 3 papers published, one that is already accepted, and some others that are under review. I had 18 abstracts presented at international conference, at ACC and American Heart Association sessions. The community in the Med Academy, I met some of the most hardworking, inspired people I've worked with my whole life. And I think it's a part of what motivates me and that keeps me working hard and keeps me committed. Because if you're working with such incredible people, you can't be the one to drop the ball, you know. It's been a year since I started the course and I already see the results. Once you have publications, once you have abstracts presented, the people that have position to offer you opportunities, they know how hard it is to publish it and they know how hard it is to present abstracts. And they know that you have to be committed, you have to be hardworking. So when they see what you did, they already know that you are all of the things before you even say anything. This